Hey, this is Manny. Just wanted to come on real quick before the show starts and let you know that if you're watching this on YouTube, you'll notice that towards the end of the show, the a minute and a half of the end of the show, the video kind of cuts off, but you can still hear the audio. We decided not to edit this and to keep it going because the information is there, and it was just a small part of the audio. So just be aware that if you're on audio, you won't notice the difference. So just wanted to come on and let you know that. Hope you enjoy the show.
Welcome to another episode of the Mr. Therapist and the Counselor podcast. And today we have Hannah Stensby. And Hannah is a licensed marriage and family therapist. She's EMDR trained, specializing in trauma and ketamine-assisted psychotherapy. We're going to be talking about what Hannah does in these ketamine groups. So stick around and enjoy the show. All right, and today we have Hannah.
What's going on, everybody? This is our third guest that we've had in studio, right? So we're kind of still figuring out the whole seating arrangement, but I feel more closer to you than I've ever felt before. So
Appreciate you,
Hannah,
man.
what's up? Hannah came out here from Los Angeles. What a drive! What?
I'm
This is
so,
true.
Yeah, you're right. I'm so
Thank you
red
so
right
much
now.
for being
It's
here,
true.
Hannah. So
Thank you, Hannah. Appreciate you.
today we're going to talk to Hannah. One of the things that we ask them when somebody comes on the show is like, why'd you get into the field? Why did you become a therapist? Why do you do this?
Hold on a second.
Okay.
Hannah, how was the drive? Was it okay? You're driving hours. Are you doing good?
It was long. It was a long drive, but you know what? It's worth it. The sun was shining. It's a beautiful day.
It
So I'm
is.
happy to be here with
Yeah.
y'all. So yeah, thanks.
Very cool. We're happy to have you.
Sunny
That's-
Sunday afternoon in the studio.
It's easier to do a transition when you're not doing it, and I can do it now. Cool. So
You're going to interrupt me moving forward. That's
I
good.
am.
So
Yeah.
back to what I asked Hannah was that when we bring somebody on to the show here to Mr. Therapist and the Counselor, we always ask like, what ignited that fire for you to get into this? So, yeah, the floor is yours on this one.
Why
here,
do you
so.
do this?
Yeah.
Yeah.
Yeah. Great question. I think for me, it really came from growing up in an environment where mental health was not talked about. I just, through growing up, it felt like there weren't a lot of answers for like, why are we feeling these ways? How do we get through hard periods? And I just felt like it wasn't talked about. And then I got to college and was taking psychology classes and felt like, wow, there's information about this. There are processes for this. This is like a global thing that happens to many people. And it just felt like, wow, people need to know about this. And I felt really called to try to support people in their development, having like a space to process their emotions and understand that what they're going through is something that many other people are going through too. So that kind of like kicked it off for me. And I just think, I think people are really interesting and wonderful. So I like to get to be a part of, the journey. And
That's awesome. So when you say was it your family, like not mental health wasn't really discussed? Yeah, I can definitely relate with that. I think we've talked about this before. Like I feel like nowadays it's so hard for our parents. I feel bad for them because they went through this period of like just being very traditional, like kind of do this, do that. Like the parenting style is just kind of like focused on what we do, right? And behavioral interventions. And now there's this movement of mental health, and a lot of us are like learning just those like early injuries maybe that are unacknowledged things that were important growing up that maybe are affecting us. And so for our poor parents, they get the brunt end of like, man, I wasn't the best parent. But
you know what? Just to that point, I think it's really great that there is that acknowledgement. I think
it is.
the idea of like parents talk to their kids now.
Yeah.
And I mean, I don't want to like say everybody's like this because there are probably more households that are fluid than what I grew up on. But like, I think there's at least a light shined on that. The fact that like we could have these open conversations about like mental health. I know it's still like, I hope the movement, sometimes I've shared this with you and I'll share this with you, Hannah. Sometimes like the mental health movement, I feel like it's so much bigger, but I know it's still like at the beginning stages in a lot of ways.
Yeah.
So like just because my social media is popping out all these like reels on things that are based because I work in the field, but at least it's started, it's moving. That's the big thing. So
Yeah. I think too, like everybody's doing the best that they can. And I certainly understand the context that my parent, like it's generational, like you were saying, when we were growing up, things were different. And I recognize that our parents had deficits because their parents had deficits. And there's this intergenerational, transmission process, and we're all doing the best we can.
Yeah.
So, but has been nice to see how mental health has really come into, I guess, a more normalized place where I've had some really great like healing conversations with my parents, and it's been great. Yeah.
I love that. Yeah. And the thing is that even though we're more aware, I'm a parent, you're a parent, we're still going to fuck up, even though we're more accepting of maybe I take more time to attend to my daughter's feelings than my parents would with me, but I still fuck up. I'll still yell at her, like get frustrated with her, or want to come home and just like watch TV, and she's like calling for my attention, and so we're still screwing up, and it's just a process, I guess, of like
being human,
and accepting that. Yeah. So, but one thing that I think we were super stoked about talking to you about was this ketamine assisted therapy. You run some groups, right, around, like you help people through a journey of getting to maybe know themselves, or what is ketamine assisted therapy about? Like, how would...
Can I ask her first though, like what about, so you're working in the field. I mean, to my experience, like therapists, a lot of times there's like a modality they gravitate to. So what first interests you about the ketamine like treatment therapy? Like, what got your attention first with that?
Yeah, great question. So I think a lot of my foundational work and training was in really acute trauma populations. I worked in a residential setting with kids who were kind of not able to sustain their placements in foster care or coming out of the juvenile justice system, and worked with really high levels of trauma, right? And folks that didn't have a lot of resources. And it was hard to create lasting change there. We're doing a lot of crisis management. So this is all going to come around to ketamine.
Good. Take your time.
And so from there, I got interested in EMDR therapy and got trained in EMDR and found like this huge shift in the ability to treat trauma and get support. Yeah.
For EMDR, just like still for people that are listening,
Yes.
just a little small breakdown. What is EMDR?
Yes.
We've talked about it a little bit on the show, but like just
No, good point. Yeah. So EMDR is eye movement desensitization reprocessing, and it's an evidence-based method of treating trauma. And it really works not just from this place of like cognitive awareness and CBT and trying to learn skills, but it actually helps you to recontextualize or reprocess how you think about past painful events that have happened so that you can like move forward. You don't have as high of a disturbance when you think about it. I think we've all can relate to like thinking about something in your body. You can like feel it in your body, right? Yeah. And so it helps to clear that part out. You still know that it happened. You can still make meaning from it, but you're not thrown back in. So like for people with like PTSD, obviously really effective, right? Those intense flashbacks, you're not having them. That's like the more extreme end, but this can happen for anything that's like a painful experience that you feel like has shaped the way you move through the world. Yeah. So started with that in 2018 and found that to just be like a game changer. Yeah. And so I'm always like looking for what is a new method, right? Like to help support the work that I'm doing. And so became interested hearing a lot about ketamine assisted therapy. And there's a lot of ketamine clinics in Los Angeles in particular, in COVID. And I'm hearing about this where people are going in and they're getting an IV. And I'm hearing about research and these pretty robust like antidepressant effects. But I was skeptical because I'm not hearing about therapy, right? I'm just hearing about people going in and getting an IV and going home.
Yeah.
Can I ask you initially, why were you skeptical? Just because...
Yeah. Well, because to me, it's like therapy is the gold, right? Like therapy is where the change happens. It's relational. I think healing happens like in connection and community. And I feel like pharmaceuticals are really helpful tools. You know, I've had many clients who have benefited from SSRIs, antidepressants, but I'm a huge proponent of that combined with therapy, right? Because we want to get to like the root. Yeah. So while we need help oftentimes to support symptom management or getting to a level of functioning where you can then access the therapy, antidepressants are great for that, but like let's do the therapy too. So anyway, that like piqued my curiosity. And I've also just done a lot of reading about psychedelics and the benefits of other plant medicines for mental health purposes. But ketamine therapy is legal. And so that was kind of one of and it's very safe. It's something that we use in surgery and have been using in medicine for a long time.
So you heard about these clinics, and people went there to treat depression and like anxiety, like just to treat like mental health systems. They just go in, they get a shot, and then they'd go home.
Right.
Wow.
Yeah. They would get not even just a shot. They're getting like an IV of ketamine at pretty high doses for about an hour.
Yeah.
They're just kind of in their room, and then
Wow.
they go home.
Yeah.
Which
That sounds super intense.
yes,
Right?
exactly.
I mean, like I've heard about the,
Yeah.
getting stuck in the K-hole, right? I don't know
Yeah.
if that would be like kind of that. That's
Right.
sounds like there's no real guidance or like.
right.
Do you feel like, I was going to ask about that. Do you feel like it is sort of informed? Like it's like sort of like the doctor's like looking at you and making sure that you do need it, or is it more like if you come in, we'll give it to you, or maybe there's clinics that do different things. I don't know.
I'm sure there's a wide range of how clinics do it, but there's not a lot of regulation, and there's not, a doctor can do it who may not have mental health training.
Oh, okay.
There's most places like that. They're not doing a lot of therapy. So my training is all from a therapist side, and we you partner with a medical professional. They handle all of that prescription, dosing, all the things that they're responsible for. And my training is really in the preparation, the set and setting, the integration, following the journey. Like, what meaning are we making from this, and how do we apply this to the goals that someone's looking to reach? Yeah,
I feel like that is a goal, like you just said. Like even if a client is taking like antidepressant meds or whatever medication they're taking for mental health stuff, like it's supposed to be paired with therapy to be even more effective. And a lot of times just the medication doesn't really do much. So it's an interesting concept. It's almost like there is research, it is helpful, but I think there's that missing link of like, how can we guide it, right? The processing, the exploration, the getting tools out of this, so that you're not just treating something without actually getting somewhere productive, I guess, with it.
Your initial experiences with it, you could probably recall the first couple times you did it, like you were most definitely more open-minded to the process, right? Do you remember like early on, like just what did you see initially that maybe got you even more involved or more interested in it, to where you've been like much more active in it, right? So what continued to what were the results, I guess, you were seeing throughout the experience?
Yeah, no, that's a great question. I mean, I can talk about my personal experience with it, because that's part of the training, is like you actually having your own journey and experiencing what it feels like. So I can talk about that, but also I've seen, in terms of clients, I've seen major shifts in clients that I've been working with much more quickly than I would have without. So for example, oftentimes when doing EMDR therapy, we'll know what the target memory is. Like, we're working on overcoming a painful memory. And in order to process it, you have to get into that space and like feel into some of those feelings. And for a lot of us and a lot of clients, even if you've done lots of preparation and worked for months with a therapist, we can still be pretty protected. And we have those protector parts that like don't let us go there. Even if we're like geared up and ready, we want to do it, right? And so one thing that I've been doing is pairing low dose ketamine therapy with EMDR. And that has created this huge shift in clients being able to be a little less guarded, right? So that they can access the healing that they want to access. And then the EMDR is able to come in and really take hold. Wow. So that's one thing that I personally was like, this is so cool. Like, I'm seeing this with my clients. So that's one side.
Ketamine it's a hallucinogenic, right? So I remember in our training, we took this addiction class in Chapman, and it's like there's uppers, downers, and there's just like all arounders, right? And so ketamine isn't like, I'm sure some people react, maybe they get more anxious, or some people
so I'll talk a little bit about that. Yeah. So ketamine is a dissociative anesthetic. Okay. So it's used in surgeries, right? Especially pediatric surgeries because it is so safe. And one of the benefits of it is it doesn't impact the respiratory system in the same way as other anesthesia where you get concerned about not being able to breathe, right? So there's that piece of it. When we're working with it in a psychotherapeutic setting, it's a sub-therapeutic dose from what like medical professionals would use. So it's like a very small amount compared to what you would get in a surgery. And it is classified in like a psychedelic space, like when like MAPS, right, is doing tons of research on MDMA, other psychedelics. So
ecstasy.
Yeah.
Oh, wow.
Yeah, essentially. Yeah.
It's all about
So,
the e-pill.
Yeah. So it's talked a
Do
lot
people say
about.
e-pill?
you love Miley Cyrus. We can talk about her another episode.
Miley
if you-
Cyrus. Sorry.
So it does create a psychedelic experience, and the dissociative part, I think a lot of people think, oh, you're just gonna dissociate, you're gonna numb out, but it actually creates a more embodied feeling for many people. It's kind of paradoxical. So you have sort of a dissolution of ego when you're in the higher doses. So there is a part of the journey where you're not really in your body and you're not really in yourself. But for many people, they do experience their journeys as pretty somatic. Okay. So it can be different for everyone in terms of how you kind of react to it.
That's important, though, because you said an embodied experience. I want to understand that a little bit. Like when I'm working with clients, I come from the theory of like emotion-focused therapy. And so a lot of the work is helping people get out of their head and into their body. Like emotion lives in your body. And a lot of times the anxiety, the depression is all in your head, and you're trying to understand it and logically put it together. It's just causing more frustration and chaos. So is that what you mean? Like it's like the somatic. So like the way I do it is I'm like, okay, let's just check in with yourself. Let's do a body scan. Let's figure what do you feel right now? Do you feel any tension? And so people get there faster, which is, when I hear that, I guess that's awesome, because like some clients can't really get there. It takes us like a few sessions for them to even get used to this idea of body scanning or getting them out of their head. So that's awesome.
Yeah, that's exactly what I mean. It is this sense of getting out of your head and into your body, because I think there is that process that you've probably all experienced working with clients or personally, where we can know something, but we don't know it in our body, right? Like we don't feel it doesn't feel different. You can tell me it's not my fault that the trauma happened, but it doesn't feel like that, right? And so this is like helping you to really access that shift, because we know trauma is stored in the body, right? Like, I don't know if you've read The Body Keeps the Score.
I've heard. I gotta read it. It's so funny. I refer that book to a lot of clients. I'm like, I haven't read it yet, but I heard it's great. But it's disorganized. Like it's stored in a disorganized way,
right,
and your body is holding it. And so if you don't know how to process it in the right way, then it's going to continue to rev up your fight or flight system, right? So that's awesome. I love thinking about it in that way, because I think when I first initially thought about ketamine treatment, like I'm like, part of me gets a little bit like resistant to it, because I'm like, man, it's kind of weird for me to introduce to a client, go do some ketamine, But I think I know I've talked to a lot of people. I think a part of me is starting to believe that like psychedelics, mushrooms, stuff like that, like it's going to be part of the mental health treatment model, because I think I don't know. I've seen some research around this stuff actually being effective. So
do you think a big part of the movement could be is that people, I don't know, I hear, we're talking about like doing the work, right? So many people will tend to say, well, I'm taking all the medications, so that's almost all I need to do. And they avoid the other part. Like I often will work with clients, and I'll be more on the like talk therapy aspect, where it's just like, it's great. You're in a good spot medically right now, you're stable, but there's still so many things you got to do. Do you think there's a big movement of just like people are sick and tired of taking antidepressants and they want a different outlet, or I don't know, like what are your guys' thoughts on that, just being in the field?
That's a good question.
Yeah, I think there's probably a population of people who, ketamine, I'm assuming it's not the first step that people take. I'm sure a lot of people that come to you have tried medications, have tried therapy, and are probably fed up with like not getting any results.
Yeah, typically that's what we'll see is like long-term depression where it's not getting better. One of the beautiful things about ketamine is it's not contraindicated to be on SSRIs while you're doing ketamine therapy. So you don't have to go off of it like some other plant medicines. I think, one thing about these, like ketamine therapy, for example, is I think it can be empowering for clients to have these experiences that they can make meaning from and maybe not have to be on a medication for the rest of their life. Like I know there's many clients who have tapered off of SSRIs with the help of ketamine therapy, and then they have a regimen that they might do yearly, twice a year for maintenance or something else.
Wow. Yeah. That's not a lot of times. Like just twice a year, you do, like you go and see a specialist. You get prescribed ketamine, and
when I say twice a year, like the cycle of therapy is typically 4 to 6 sessions. That's like what the research is showing right now.
Nothing. That's crazy.
It's pretty.
That's
rapid.
fast.
Yeah, and that's with integration sessions in between as well. So
that's probably what makes it so attractive, right? When you're like telling clients about it, and someone that's been in therapy for 3-5 years and they haven't been able to resolve anything, it's like, man, that's awesome.
Yeah, and I think one of the kind of qualities of ketamine is that it gives you this perspective. So with that kind of separation from yourself, right, you also have a break from ordinary thought patterns. A lot of times for people who experience severe depression, like those thought patterns are pretty gnarly. So getting a break from that and getting a break from the sense that I am depressed versus like I experience depression at periods of time. So even when you're under the influence in that altered state, you're not experiencing depression anymore. So it provides this break, right? Where maybe some people haven't felt that for years. And it doesn't mean that that's going to be completely fixed. It's not a magic bullet, but just even to have that little window into something different.
Yeah, the breather, right? Because a lot of times you're under pressure. A lot of the times people who are having suicidal thoughts, it's this feeling of like, I'm just done feeling like this and I just need a break from it. And so if you can get a break from that using this treatment model, I'm assuming that a lot of people find that very attractive. What you said, you used the word plant-based treatments. I'm curious, like, what is that? Like, are you talking about like weed and like?
Yeah, I mean that's one of
mushrooms
them. There's protocols out there for like marijuana in cannabis, I should say, in therapy.
You're so professional. I'm like weed, grass.
But also like
grass?
psilocybin, in Oregon, that's legalized.
That's mushrooms, right?
Yes.
Sorry, I'm using these street names.
Yeah.
Wouldn't expect anything else.
Yeah, and then there's like ayahuasca that's been used a lot. So obviously ketamine is not a plant, but it has been kind of put in a similar category, I think, in some ways. But that's the beauty of it as well, is that it is this really known Western medicine that is very safe, and we're not like appropriating it either when we're using it as well, because a lot of like psilocybin based therapy is from indigenous cultures, right? And so then there's that whole dilemma of like going in and kind of taking this medicine, and what is that like, how do you do that and be in right relationship? And so there's less of that with ketamine.
There is like there's like a feeling in a lot of people's beliefs that like this is like these are drugs, and there's like we went through that whole period of like war on drugs, and so there's just still this effect, I think, that people see this as a negative thing, right? Like this is not how, like, I don't know, it's hard to see this as a good thing, right? But if you look at it, I think obviously the research is there, but I'm sure, do you ever get people that are like, fuck are you talking about? Like,
yeah, certainly. And even myself, right? Like it was a whole process of like, what do I think about this? And I think where I've landed is that like, medicines or drugs are not inherently bad or good, right? They're neutral. It's our relationship to them and understanding like the power or the impact that they may have on us, and for us to appropriately use them in a setting that's going to be beneficial. Yeah.
We have some listeners who work in treatment,
Yeah.
right? And so I'm just imagining like what their reaction is going to be to this. But it, like we took a, you know, and back to that, referencing that addiction class we took, like there is the levels of like how you use substances, right? The dependence on substances, like there is like using it, and whether let's say alcohol, for instance, you can use it socially to connect, and it's a good thing, like for your mental health, to connect with people, to share laughs, to share, you know, a beer with somebody, and then you can maybe start escalate that a little bit to, you know, maybe it's more less excursion and more of a dependence where like now you're just kind of drinking and you kind of need it to connect, and then you can even move a level up where now it's like, okay, now I'm drinking all the time and I'm sort of like having this physical dependence on it. And so I think there's a responsibility to talk about that a little bit, and like how you use this is important, right? You're not just talking about people buying ketamine off the street and like using it, or marijuana off the street and just using it. Like there is this medical model or therapeutic model around how to use it, right?
Oh yeah, I want to speak on that because initially when I said I'd mentioned like not you by name, but I was talking to some staff because I work in the recovery field, and the skeptics just came out, right, all of a sudden, right? People were ready to like question it, and I'll say I'm probably one of those people initially to be like, you know, sobriety is what? Full abstinence, right? And people are hesitant with new things and new ideas. So yeah, I guess on that topic, bringing that up, people that are listening are going to be like, no, this is just an outlet. What have you encountered throughout your experience with people with like severe history of addiction and all of a sudden them seeking out treatment? Like for you, just your personal experience, like how do you balance that? How do you recognize that? Like what would you say to like somebody who says, listen, I've been sober, you know, using AA for 20 years, and I believe that like this model is not effective. Like, I don't know, just any of that. What are your thoughts on some of the things I've said here?
Can I add context to that?
Yeah, of course.
So in AA, in the addiction treatment and recovery world, there is this big belief that like if I'm addicted to one thing, if I'm addicted to alcohol, then I'm addicted to everything. I just have, you know, addiction is a disease of the mind, and so I can't consume any substances whatsoever, or I will get back to the dysfunction that I was living beforehand. So I guess your question was like, how do you right? Like
I want to
treat
add a
that?
context on top of your context.
Yeah.
I guess it's hard to say like if somebody walks in, right, and has that mindset. I'm not going to speak for Hannah, but like that's maybe you can't convince that person, right? Like they're going to be stuck in their ways. But I guess it's more the idea of like how do you introduce this new idea to somebody that does have a history with substance abuse in general?
Yeah, I mean, firstly, yeah, I'm definitely not here to convince anyone, right, that they should do it. It's a powerful tool. But and in any case, like when I'm meeting with someone who's considering this or is interested, there's like a series of like screeners, right? So we're initially like I'm speaking with them and looking for like history of addiction, there's other, you know, psychological contraindications as well, and then they also have a full medical eval for any physiological stuff going on. But as part of all of that, I would be asking them like, what are their goals? Like why do they think maybe ketamine therapy might be appropriate for them, right? Is it an impulsive decision where they're like, oh cool, like I get to do a drug and it's called therapy, and so I can like it'll pass for that? Or is it like I've realized through my addictions that I've had like some pretty significant traumas that I've not been able to overcome, and I really want a space that could help me with that, right? I'm really suffering, or I'm having like pretty severe suicidality, and that gets in the way, and that causes me to be triggered to use other substances. We know ketamine's super effective for interrupting those suicidal thoughts. So it would be more about the why, right? And I think really working with them, this isn't going to be a quick decision. This isn't going to be something that you sign up for like on Tuesday and you do on Friday. Like it would be a process, right, of building the rapport with the therapist. Maybe if they have another therapist who's been with them through their recovery, collaborating with them, and really building in like what is the appropriate type of treatment. Maybe that client's not going to be one who does a full psychedelic journey where they are having the dissolution of ego. Maybe they're doing a lower dose, which is we call a psycholytic dose, where they're doing therapy. They're still present and able to speak, but they're just having the effects of the medicine enough to get some benefits, right? So we would play around with that as well.
Yeah, for sure.
Did that answer your question?
You did.
Yeah.
I'm just taking it all in. I might have heard you wrong, but you said like you talked about clients, but you said your own personal journey as well. Like, would you mind sharing about that?
Absolutely. So as part of my training, I got trained through the Embodied Life program with Lauren Taus, and she's studied with all of the founders and people involved with MAPS trials. And part of the training is an experiential process, which I think most of the really legitimate trainings out there require that, right? Like you're not going to ask your clients to go somewhere you haven't been.
Right.
So, I mean, certainly I experience like nervousness, like it's letting go of a lot of control, right? It's like an complete unknown, and will this be helpful, or what will I encounter? What will I discover about myself? And, I was at a place where I've been doing a lot of like personal work for the past year, a lot of my own therapy and things coming together in really great ways, but also a few areas where I was like, what is this about? Right? Like it's still not, we're not getting through it. I'm not connecting it. And so that was one of my intentions going in. I did a lot of really intentional journaling and questions to ask myself before and going into the psychedelic journey. And I really got some great answers. Like one of the things I had been struggling with was this feeling of like being left out in different areas. And what I discovered was, I don't know if you're familiar with like parts work or IFS.
Yeah, I love parts work. Yeah.
So that was my frame kind of going in, but I really met like different parts of myself that I think had been exiled, right? I wasn't willing to go there. I wasn't willing to accept that about myself. And like in my journey, what I was getting back was like, nobody's abandoning you. You are leaving yourself out. And it was this really like healing experience, and it just shifted my perspective. So then coming out of that journey, that didn't just fix everything, right? But that was a new context with which I looked at that thing that had been coming up for me. And then I was able to approach relationships differently. I was able to approach my like personal practice of mindfulness and relationship to self differently. And I found that to be like a game changer, honestly, for me. So that's like one example of how I got some buy-in. Yeah.
So I'm gonna share my experience with this, and I was like kind of hesitating on doing this, but I think it's important because it's exciting that you were able to connect with parts of yourself. Just like I do parts work with people, and parts work, just for people to understand, is
what is that?
Yeah, the theory is that like there's different parts of ourselves inside of us, and a lot of times they're expressed in like thoughts or emotions, and so a lot of times when we're not feeling very well emotionally, they're in conflict or they're not being acknowledged. And so part of the process is to go in through like focusing on your body or your feelings and really understand like what is the conflict or what isn't being acknowledged, and give it understand what the need is emotionally and give it that, right? Whatever it needs. And so I don't know, that's exciting to me because I'm comparing it to my experience using mushrooms one time, and how much of a different experience it was. Like it just feels like the ketamine assisted therapy is so guided to take you to a therapeutic place. When I did the mushrooms, I remember
the mushrooms.
I don't know how you say it.
Was it one mushrooms or two
like
mushrooms?
Half of one,
like an eighth or something like that.
But anyway, my friends at the time, they when they explained it to me, they're like, "Oh, it's great. You hallucinate. You see all these different things or whatever." So I was like, "Okay, like let's try this," you know. And my therapist self wasn't so fascinated by the hallucinations or like the seeing things. Like I felt like it was cool, but whatever. I went into like this meditative state. I was like, I want to meditate right now, like, and just kind of connect with my body. I mean, I think that's probably more than what the normal person would be doing, right, therapeutically. But I remember at the time, I was feeling really shitty, like emotionally. Like I was feeling very like self-conscious and like just not very connected with people, I guess. Kind of feeling like not not feeling very confident in myself, feeling like I was just a shitty experience. And I remember doing the meditation and being able to like love myself. And
In the process. Wow, that's
like
pretty good.
like meditating and thinking of all the people who are in my life and appreciating that these people are in my life, appreciating that, like, you know, one of my friends, we were going to hang out with them that weekend, appreciating that that person wanted to hang out with me, that I was someone in that person's life who cared enough about me to hang out with me, that my wife was in a relationship with me, and that there's all these things she does with me, and that I make her laugh. And like it was so strange, but it was like looking back and what you just said connected me to this idea, and I didn't connect this until now. That's what I needed. Like I wasn't seeing myself as worthy or as like someone that brings value to the world, and I was feeling shitty because of it. And like, you know, thinking about parts work, there's a part of me that wasn't being seen, that wasn't being loved, that wasn't being appreciated. And I think probably because I'm a therapist, I was able to get myself there, right? I mean, people don't talk about mushrooms with this type of experience, but
but no, they usually don't. I'm reflecting on like my like experiences. I was like, I did not have my shit together while I was doing that.
Set and setting, right? Like, how are you going into that experience, and what are you doing with it, and how are you integrating it?
On the other end, my experience using marijuana is not very good. Like, I actually, like, I get depressed. I overthink. It like puts me in a really bad place. And so I remember having to stop doing that because it was affecting me so bad. And so I don't know, it's just so interesting. That's just like, one, like just the way these different drugs kind of affect you. And then two, like seeing them in a different light where you can use them as a healthy process. Right. So,
you know, I'm taking a lot away from this conversation. I was reflecting too on just like your own personal experience with psychedelics. And I remember the first time I ever heard of ketamine. I think it was like a house party in 1999. I'm pretty sure like Fatboy Slim was like on this on the radio. If anybody knows who that is, I'm sure a lot of people do. But I remember like, hey, here's some Special K, and like I think it was bunk. Anyways, I don't think it worked. But
you were at a party with Kid and Play.
No, it's the 90s, bro, not 80s. But like, you know, unfortunately, like a lot of my experiences were tied to like psychedelics, but like not really having any type of like prompting except for like, I don't want to be me. I want to escape me as much as possible. Life is not good. I don't know what happiness is. So, and I guess maybe we've already kind of talked about this, but I want to reinforce this idea. Like for those that are listening, and you know, some people are going to have a stigma with this, and I understand that, and I gotta say I also respect that too, because if you are sober and you're like, I don't want to do this, and I'm not, you know, I totally recognize that. But I think that's something that's really what's important, that I tell a lot of people, clients I work with, is like being open-minded is also very important. And I told people before you did this podcast too, before you listen to it, like try to be open-minded to like, we're in a different time and setting, and I think that it's important to just try to consider like there can be alternatives to different things that maybe you didn't experience that somebody else has. I'm taking in so much from this, and this has been like just a lot to take in. It's just such good to hear you like share this and be open about this as well. So
really excited.
I really admire the fact that you were able to talk about that personal journey, because you said something that really stuck out to me, because you're like, I wouldn't go through this like with my clients if they had it. And I've experienced this working in, you know, treatment addiction settings. Sometimes clients will feel a little bit of a disconnect with therapists because like, you don't know how I feel. You've never been through that. And to hear you say that, like that really, like, I think could just like open the door for somebody who's a little resistant on this.
Yeah. So a fun question, kind of like how did your parents, like, I'm thinking about my parents. They're going to listen to this show, and they're going to probably have a talk with me about, like, what do you mean you did mushrooms? Like, so, sorry, Mom. But did they have any, like, you know, like, issue around this? Or do they still work? Are they still trying to, like, work with it?
Yeah, it's interesting. I think they generally support it because they support me.
Yeah.
But I think they were sort of like, now what is it that you're doing? Like, what kind of training this, right? How does this work? How is this different than people
can
just
I
taking
sign up?
drugs?
No.
Yeah.
Right.
Yeah,
Wait,
so
you're
there's a
doing
little
drugs this
little bit of
weekend? Yeah.
skepticism there, but I think I've tried to be pretty open and like share what I've seen be the differences and like what the positive effects are. So
And you have your life together. You're not
Yeah,
like
that helps.
you're
That
not like
helps.
living on the street at Redondo Beach, like this new therapy model I learned. Yeah.
Yeah.
I don't know. Any other thoughts?
No, I mean,
Yeah.
I thank you so much for coming
Yeah.
out. And Hannah, is there anything that you want to like plug or promote? While you're here.
Yeah, I can talk a little bit about my practice and kind of the
Yeah.
offerings that I do with ketamine assisted psychotherapy. So my practice is called Flourish Mindset, Marriage and Family Therapy. We are based in LA and Walnut Creek. We do teletherapy and in person. And in terms of, we see everyone, a broad range. We really specialize in relationships, couples therapy, relationships, and trauma. We do a lot of EMDR therapy, and obviously the ketamine assisted psychotherapy. And with that, I'll work with couples didn't even get into that topic today.
Dude,
But
I was
now
gonna
that
ask
you said
you.
that, so you have couples that do
Yeah.
ketamine.
They
Mhm.
ketamize together.
Yeah. Yes. Yes. Yeah.
Sounds so
can
romantic when you
yeah,
say it
it
that
can
way.
be pretty effective, which I would love to talk
Troubled
to you all at some point.
couples and like couples who are just doing sort of like
Yeah, for for relational repair, right?
Wow.
You can share on
yeah.
that, please. Dude.
let's
Yeah.
talk about that. Yeah.
Yeah, so I mean, it can be in this similar ways as you're using it for individual work and really meeting parts of yourself and understanding. It also, similar to what you're describing with your experience with mushrooms, like you can have this step back, right? You have this perspective on things that's different, which we know oftentimes when you're in a relationship, we can really get stuck in these cycles and these views of our partners and ourselves. And it's hard to break out of that. So that's another way that ketamine assisted psychotherapy can help, right? Yeah. Shift things. And then when you're in that place, like one of the kind of neurobiological benefits of ketamine is that it promotes neuroplasticity, right? So new growth. So you can be right there with your partner, with your brain primed to think about things differently. Like say you're trying to repair from betrayal or just get out of that cycle, right? It can really help in that way too.
Which, if you think about, like we talk about trauma and how this really helps with that, with curating or treating that experience of trauma, like a betrayal is a lot of times traumatic. Like
100%.
I think the toughest cases I see, like there's been infidelity, and it's like moving on from that when it just any little thing can bring you back into that state of like, man, is my partner being unfaithful? Are they doing it again? Like, and so I'm thinking about how beneficial it would be to like have something like this that gives you that perspective change and can fight those, because that is also that manifests because of feelings and thoughts, right? And so that's amazing. I never thought about you being able to use this with couples.
Yeah.
So
we do the couples work, and then we also do individual work, and like I was explaining, that lower dose psycholytic where you're still speaking and we're processing throughout, and then the deeper journey. And then I also do groups. So I've been doing some groups for therapists actually, and other like healthcare workers, small groups, like 5 people, because we want it to be an intimate setting. And then, groups just for anyone looking to deepen their experience. And then you can do integration follow-up, like one-on-one. So you can have your experience. That's that deep journey. It's more of an internal process anyway. You can journal afterwards. We do a brief share at the end, and then we do a group processing, but then you can do more in-depth integration individually.
wow.
So, yeah.
And so you probably find all this out on your website, right? In case
Yes.
anyone's got interest in those offerings. Okay.
Yeah, flourishmindset.com. Yeah.
Okay. Very cool. And then we'll attach your social media to the description so people can follow you.
Thank you so
Thank you.
much.
Yeah, this has been
Thanks.
fun.
Awesome.
Thanks.
Yeah.